Hey, everybody, and welcome to the Dr. Mom Show. It is Dr. D, mom of three. I'm so excited that you're joining me today for this week's episode of the Dr. Mom Show. Just a couple of things. Don't forget to check out the Dr. Mom Show website at www.drdaleemushalak.com. Also, don't forget to go to YouTube and the Dr. Mom Show Facebook page and like it, subscribe. Don't forget the Dr. Mom Show is on every Wednesday, 8 p.m. Eastern Standard Time live. And now you can listen on Tuesdays on Radio Love at 1 p.m. Eastern Standard Time. And of course, if you miss it, you can always go to platforms like Spotify, iTunes, some other platforms. And if you check out my website and on Facebook, you can see some of those other platforms that you can tune in at your convenience. Most new cars now have Apple Podcasts, which used to be iTunes, in the car itself. So you can listen to those podcasts for free. So definitely check it out. And don't forget to like and subscribe. So today we are talking about something that's so important, and it's because this week is Suicide Prevention Week. So today we are talking about don't let suicide take anyone's life. We all matter. And I just want to remind you that you matter. I matter. Your children matter. Your spouse matters. I mean, everybody matters. Everybody is on this earth for a certain reason and a certain purpose, and we're all special in our own way. We all may not have features that social media puts out. So a lot of people are like stuck on blonde hair, blue eyes. Everybody wasn't made like that. God created each one of us differently. However, I am here to say today that one feature does not make you more beautiful or make you matter more than somebody else's feature. Because you know what? I love my dark hair. I love my dark hair so much. So I can't say that enough about that. So definitely remember that you are made very special and you are molded by God into what you are today. He took the time out to make you exactly how you are today, and there was a reason for that. So do not forget that. So today, as we delve into suicide, essentially my goal is just to give you some tips, some ways to know what the warning signs are, what the risks are, so you can be better prepared, so you can recognize suicide or suicidal thoughts in somebody such as a friend, yourself, family member. So that's why this is so important. So before I get started, I just want to give you some statistics from the Centers of Disease Control. So essentially, there's about 14 people in every 100,000 persons who commit suicide every year. Now, you may say 14, that's nothing. But you know what? If one of those people were your friends or your loved one, it would definitely mean something to you. So that's why it's so essential that we know more about suicide and how to recognize it. Another astounding fact is, of course, that suicide is more prevalent in males than it is in females. And that's more so because females have a tendency, when they attempt suicide, to attempt it in a way that will be more harmful in the sense of causing long-term harm to their body versus something that is detrimental. And what I mean by that, statistics show that the majority of males will attempt suicide via firearms, and the rate of truly hurting yourself and killing yourself with a firearm is very high. Now, whereas women will try to overdose on like Tylenol or aspirin, or if they have medication that they take, like depression medication or anxiety medication, or they will cut themselves. And these are things that, again, it takes a lot in order for that to equate to somebody killing themselves, but it causes harm. And I hope that makes sense. So for example, if somebody overdoses on Tylenol, that takes an extreme amount. But what happens is it causes liver damage. So you don't essentially get to the harm part of like the entire body death, but you're causing specific damage. And we had a close friend recently, mention that someone in her family drank antifreeze, and that's something that we see. Again, something that takes a lot to kill you, but it can have a lot of damage and consequences to your body. So burning the esophagus, sometimes those patients aren't able to drink anymore. They need what we call a PEG tube or a feeding tube, essentially, because they can't swallow. So they'll have to use a tube. So again, it's more so bodily harm. And the same thing with cutting. I know people see on the movies all the time that people slit their wrists, but there is a very exact way to do it. And the majority of people, I mean, essentially almost all people, unless you're medical, don't know how to do it, because you have to cut the blood vessel well in order to bleed out. And people don't know how to do that. So what happens is people do multiple cuts trying to make themselves bleed out, and instead do more bodily harm. So again, I hope that makes sense. So again, it's just that males usually attempt suicide in a way that is more harmful and detrimental. Whereas a lot of women, and again, I think this also has to do with the nature, and this is more so me saying this, has to do with the nature of women, that a lot of times it is also a cry for attention, that they're lonely, isolated, and just need help and just need love. And in reality, we all need that. We all want attention. We all want love. We all want somebody to care for us. So before somebody gets to that point, this is why it's so important to recognize this before it gets to that point. Now, let's talk about risk factors. So we need to know the risk factors for suicide. So one big one is a history of any mental disorder, so such as depression, anxiety, schizophrenia, bipolar, alcohol use, drug use. So any of those puts you at higher risk for suicide. Of course, genetics. So if there's a family history where somebody has committed suicide in your family, the risk becomes higher, especially if there's an underlying mental illness. Another thing that we've seen is people who have served in the military. And part of that goes back to mental illness. If a person ends up having PTSD, or what's called post-traumatic stress disorder, and we see this a lot of times in our vets or people who come back who have fought in a war, and they just suffer from these nightmares, from these thoughts of what they have gone through. And you know, you don't have to fight in the military to have PTSD. Again, another risk factor is somebody who is being abused, so physically or mentally or emotionally has been abused when they were younger. If they're currently being abused, again, that can cause PTSD, and again, also a risk factor for suicide. Another risk factor is people who aren't married. So of course, when you're not married, let's say, and this, I'm not saying that single people are at higher risk. It's if you're a single person and you're isolated, you've isolated yourself from others. Whereas somebody who is married, usually around somebody, you have a partner. You know, I would hope that with your loved one, you can talk to them, have a conversation, let them know how you're feeling. So those are all risk factors that increase the chances of suicide. Now, what are some warning signs? Some warning signs that we need to be aware of. I spoke about the drug and alcohol use, but if you see that there's an increase, so of course, any family would be worried about an individual if they're using drugs or alcohol, but anytime you see that that use is going up and getting even more and more out of control, that should definitely be a warning sign. Also, if somebody is voicing that they have thoughts of suicide, or they have an active plan, they know how they would do it, that is also a warning sign. Of course, if we have somebody who has attempted suicide in the past, that is a warning sign and a risk factor. So again, these are all things. And another one I just want to mention, if somebody is hopeless, if they just feel like, you know, I'm done, I don't have any alternative. And this is so pertinent right now during these unprecedented times. People are isolated. Some people have lost their jobs. Some people are working at home and by themselves. Let's say they don't have their family. So again, just isolated, away from their routine, doing things differently. Some people may be in financial debt and don't know how to pay it, especially if they've lost their job. So these are all things, especially during this time. And unfortunately, during this time with everything going on with the COVID-19 pandemic, we have seen an increase of anxiety, depression, and insomnia. PTSD. I mean, these are all things that I've talked about in my past shows. So we have seen these things increase during this time, that there's an increase in mental illness. One, there's an increase of symptoms in patients who already suffer from a mental illness. And then two, there's an increase in the diagnoses of mental illness and people who never even had a mental illness during this time. So this is having such an impact in our one country and in the world. So definitely remember that. So another key item I want to share with you is get evaluated early. Or if you have a family friend who needs help, get them evaluated early. So again, I always say, make sure you at least do your annual checkup with your physician. At your annual checkup, a depression screen is done. And we start depression screen as early as 11 years of age. And of course, even when somebody has a newborn baby, at the baby's visit, we even ask mom if she's depressed, because as you know, there's something called postpartum depression, that women within a year's window are at higher risk of having depression, because again, it's a time of isolation. It's a time, it's just overwhelming. You're doing all these things. You're trying to be a good mom and raise this baby and be the best mama, breastfeed, do everything. And again, sometimes it becomes lonely. Sometimes it becomes overwhelming and stressful. So please, please, please get evaluated early, especially if there's any active suicidal thoughts or ideations or plan. You need to get evaluated. Now, if there is an active plan or somebody is actively saying that I am going to hurt myself, this person needs to go to the emergency room. Most of the times, these patients will be admitted to the hospital. They will be put under the care of a psychiatrist in order for them to be safe, in order for them to be in the right program, in order for them to get the right care. If it's somebody who, let's say, has started to become depressed or anxious, doesn't necessarily have suicidal thoughts or ideations, you know, these people can be treated as outpatients. So that means like they can go home and just start medicine or counseling, whatever the physician feels fit at that time. But again, there are some people who need to be admitted and need to be in the hospital during these times in order to get the best care. Now, once you receive care, it is so important to follow up. And this is important because, one, patients who are thinking about suicide or who have attempted suicide, they need a good support system. They need support. They need to be accountable and they need to be encouraged. So not only do we need to make sure that we're saying, hey, do you feel okay? Are you having any thoughts? You know, how are you feeling? But we also need to say, hey, awesome, you are doing amazing. I am so proud of you that you have made it this far and you are continuing to keep your appointments, whatever the case may be. But those two things are needed, accountability and encouragement. So don't forget that, because remember, it is so important that we say kind words to people. You will never know. I remember one situation where I spoke at a meeting. It was a women's conference, and none of these women I knew. I knew a couple of women from, you know, from other places, but it was probably a handful of women who I knew. But the other women I did not know. And I spoke about self-empowerment and just being the best you. And later on, I received an email. I gave my email address out if anybody wanted to contact me or follow up or had questions, that they were welcome to do that. And later on, I received an email from somebody who said that I just want to thank you for your kind words. And again, remember, I was speaking at a conference. I wasn't speaking to anybody individually. And they said, thank you for those kind words of encouragement during your talk, because I was planning to hurt myself later on that day. So she was suicidal. She had a plan. She was going to attempt suicide. But because of the talk, because of the words that were said, she said that she changed her mind because she realized her life had more purpose than what she was living now. And she mattered. she mattered, where at that point or prior to that talk, she felt that she did not matter. So again, it's so important to smile at strangers. It's okay, even if they think you're crazy. I mean, I smile at people, and I teach my children to smile at people, to say hello. And then of course it's rude if people don't say hello back or smile back, but you know what? That's them. But at least I know you never know what people are going through. And that's why it's so important to smile at people you don't know, to say hello, to say thank you if somebody holds the door, hold the door for somebody else, say have a great day. Little things like that can make such a difference, because there's so many people in this world who feel that they're not noticed and who feel like they don't matter. And those small words from a stranger, especially a stranger, can make such a difference, because then they realize, you know what, if that stranger noticed me, this person who I don't even know notice me, it could change everything. So that is so, so important. And of course, again, I wanted to remind you that this week is National Suicide Prevention Week. So take the time to share the video, check out the podcast. If the podcast is simpler for you, go to town with that, share the podcast, because again, this isn't necessarily that, you're thinking about hurting yourself, but if you are, get help. But this is somebody out there at some point, somebody's committed suicide, and it has touched each one of us. So I want you to think about that. So whether it's a friend, whether it's a friend's friend, whether it's a family member, whether it's a close family member or distant family member, suicide has touched everyone's life. And that's why it's so important to share this and spread the word, spread the knowledge, spread the information out there, so people are aware of the risk factors, the warning signs, how to get help, the options that are out there. And of course, if you just search for suicide help, there's hotlines that you can find. There's support groups that you can go to. Of course, now there's probably not in-person groups, but there's online support groups. So there's so much information out there. And, if you're in a high risk factor group, definitely, and, you're not necessarily having active thoughts of suicide, but if, you have a history of depression, anxiety, again, anything that increases your risk, or you're just not feeling like you're worth anything, you definitely need to seek that help. And remember, it's one day at a time. We take one day at a time. So again, don't forget to share the video. Again, the takeaway points are to make sure that you know the risk factors, know the warning signs, seek help early, make sure you follow up in order to get the support, accountability, and encouragement you need. And finally, be kind, because kind acts change lives. So I hope you enjoyed the show today. Definitely don't forget to check out the Dr. Mom Show podcast on iTunes. Don't forget to subscribe and rate the podcast. Come on, help support Dr. Mom and the triplets. Let's get out there, support each other. Let's collaborate. If you want to hear any topics on the Dr. Mom Show, definitely let me know. You can always email me at drmomshow@gmail.com. And again, don't forget to subscribe to the Dr. Mom Show on YouTube. And don't forget to connect with me on Instagram at drmom_show, and on Facebook at the Dr. Mom Show. And don't forget to like those pages. And of course, do not forget to wash your hands, kiss your kids, love your families, and say your prayers. Good night. Love you guys. Bye-bye. From Dr. D and her 3. Bye.